Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. In studio today with us is returning guest, Mr. John Malanca, founder of United Patients Group, a leading resource in medical cannabis information and accredited education. He's returned with us to talk about the recent second annual conference known as Medical Cannabis, the Science, the Truth. Welcome back to Health Professional Radio, John.
Thank you for having me.
Thank you. The recent conference, the second annual conference held this past May, it was called Medical Cannabis, the Science and the Truth. Talk about the goal of this second annual conference, and is it the second annual because the first one was so successful in raising awareness?
Yeah, it was funny. We didn't start this company to be in the conference business, but the information that's out there, the lack of information that's out there, and the request, people would always say, why don't you do a conference? So we did our last conference last year called Medical Cannabis, the Science, the Hype, which was extremely successful. And so we said, okay, let's do it again. As you know, people were asking us, when's the next one? And what makes our conferences different than the others is it's strictly educational. It's in a college university setting, very similar to medical school, and we reach out to the medical community. It seems like every time we do there's a conference in our industry, it's the same people attending and the same speakers. And so we reach out even further to the medical professionals that are on the fence, that are curious, that are against medical cannabis, or looking to educate themselves. This year, I didn't mean to cut you off there, sorry, Neal. But this year we had about 85% medical professionals that attended. And what makes our conferences also stand out is that they are accredited. We offer CME accreditation. Our courses are CME accredited, as well as we do CEUs for the nurses. And then we do a 3-day event. The first day was our pre-conference nurses workshop. And then on Saturday and Sunday was for the medical professionals, nurses, medical professionals, and the public.
You know, when you hear the word conference, you are reaching out to medical professionals, but being in the medical cannabis industry, cannabis, medical and recreational, it's an industry. What about investors or booths, that we normally find of vendors and things of that nature, that are trying to, sell their ideas or something that, maybe you're not necessarily for or against, but it's a conference atmosphere. What are we talking about here?
Yeah, and actually that's another thing that makes our conferences different is that we do not have boothing at our conference. We feel that doctors and medical professionals want to come to spend a weekend with us, but come to learn. And so not saying that boothing is wrong, but from the doctors that we've worked with over the years, they would prefer just to come in, get their education, and then come back the next day instead of being stopped at a smoking section or having to walk through a smoking section or stop at booths. And so that's just our personal view on this. I've been to great conferences that do have the boothing. I've been part of conferences that have boothing, and but we just felt that our conferences are different for that reason, and we do it at every year we do it at Dominican University, the university locally here in the Northern California area, and so again it brings the university setting where doctors don't mind that again are on this fence of wanting to learn about medical cannabis and they don't know which side they're on. But they do feel more comfortable attending a university-style conference.
Now, your roster of speakers includes, politicians, nurses, physicians, researchers, even authors, professional athletes, police officers, you name it. Now, I understand you can't, as one person, talk to everybody there or field each question that may be posed in this workshop or that workshop. But in your own experience, what is maybe the one question or topic that you seem to find yourself discussing with health professionals when it comes to medical cannabis or cannabis in general, from your own standpoint? What's that one topic that you need to talk about with these folks to get them to either understand one way or the other?
Well, I think when they see firsthand the patients that we do have at our conference, share the success stories. Of course, seeing my father-in-law alive and living, he just had his 7th lung and brain scan about 3 months ago, and knock on wood, all 7 have come back with no evidence of recurrent disease.
Wow.
So patients like to see success stories. We had a young boy, Colton Turner, that has Crohn's disease, and he's a wonderful, wonderful little guy, but he's successful. You know, he started off in an illegal state. Cannabis was not their lifestyle. You know, he was 11 at the time when he and his family traveled to Colorado, and they had success. He's 16 now. They didn't expect him to live past his 11th birthday, and he's 16 and thriving. And I love his motto is, "I'd rather be illegally alive than legally dead." But he was a big draw at our conference because, you know, it brings a humanistic effect when you see a child in there. But having the research, having the science behind this, and what a lot of doctors ask us is, does this really work?
Yeah.
And when they see other medical professionals sharing the science, they feel more comfortable. You know, because their patients are asking about this now.
Talk about the future of UPG, Corinne.
Hi, Neal.
Hey. So as you see the future unfolding as your mission being to be a leading resource for information and education as far as medical cannabis is concerned.
Yes, absolutely. We find that the key to patients getting the proper direction and the proper care will start with education, not only for themselves, but for local and foreign governments, physicians, nurses, pharmacists, which we work with them all. And our goal is to start from the top down and create a community of scientifically backed information all the way so that it'll trickle down to the patient, so they don't have to waste time. We find that a lot of patients have wasted time reading on the internet information about formulations and dosing, and they buy products. They you know, a lot of people are at end of life, and to waste that time is so precious. So we focus on streamlining the process, helping patients, local and foreign governments to avoid the tangled web of information and streamline it so that patients can get the proper help. So our goal is to expand as largely as possible so this help is readily available to patients, physicians, nurses, and so on.
Now, in wrapping up, Corinne, how can our listeners become involved and help UPG in your efforts?
Well, number one, we are a nonprofit. Our educational division of our company is nonprofit, so always donations help. It costs us quite a bit of money to put on these educational symposiums. We had self-funded for 5 years, and thankfully we finally have our 501c3. So donations help a lot. We are educating nurses quarterly, so the more donations we have, the more globally we can impact the world in this science. So that's number one. Of course, we have ambassadors all over the world. We're always expanding that. We're always in need of writers, and we're happy to supply anybody with paperwork and information if they want to be bringing it to their medical community. We have a lot of people that do that for us. So they could just call our office and ask what would suit them best for whatever demographic they're in, and we would be happy to place them somewhere to help us.
Great, great. And if you'll travel to unitedpatientsgroup.com, just click on the Get Involved link, which you'll find at the website on the homepage. You can learn more about the UPG conference, learn how you can donate, volunteer some of your time. You know, it's been great talking with you, both you and John, Corinne.
Thanks so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.